In this lesson, I'm going to go over the discomforts of pregnancy and what's causing them and what we can do for this patient. So many of the discomforts, they're happening to the entire body. And because the whole body is affected, we have many different discomforts occurring. Everyone is going to experience something different because pregnancies are all different and dynamic. So somebody could be in their second pregnancy and neither one of the pregnancies be anything alike, or it could be two different people and they're going to both be different and dynamic because every pregnancy is different and dynamic. Then most discomforts are going to be caused by the expanding uterus and pelvis. So we have the uterus growing and the pelvis growing, or stretching out. So we're having problems with that causing discomfort, as well as hormonal changes occurring, and then the increased blood volume, which is just going to cause some different things to occur. So some of the generalized discomforts of pregnancy that women can feel are going to be that fatigue, just constantly being tired, headaches. They might have backaches occurring. That's just the structure changes happening to the body, causing back pain, nausea, vomiting, weight gain. We'll have edema occurring, just some generalized edema. Round ligament pain. Now here are some round ligaments to show you, give you a visual. So the round ligaments are structures that hold the uterus in place. And as that uterus is growing and stretching out, there's pain felt here because the pressure and the different changes as the body is growing and that uterus is growing. So they'll get some pain in their groin, and that's the round ligament pain usually is what that is that they're feeling. And gait changes, that's going to be another change that can happen, causing some discomfort, just that wobbling gait as everything's kind of being relaxed and stretched out to make room for the growing fetus and accommodate it. So with our female and genital urinary system, there's going to be changes as well. So there's going to be urinary frequency occurring, and that's because of this uterine structure is going to be putting weight on that bladder, making it women feel like they have to go a little bit more frequently. Also, we have to worry with these patients about UTIs because a lot of times women aren't able to fully empty their bladder. And so they will have UTIs because of this. So just something that we need to watch for. They're also going to have an increase in vaginal discharge. Now, this is because there's a lot more vascularity that's occurring in the vagina. So with the vascularity happening, there's more moisture. So yeast is going to be a big problem with pregnant women, just an increase in yeast production and discharge from that. So to watch for that. Also, we're going to have breast tenderness, the breast pain, growing breasts, so just another discomfort that can happen because of the pregnancy. And then with our cardiovascular discomforts that occur. So for these patients, the blood pressure is going to lower. So with this blood pressure being lowered, it's going to cause that syncope and lightheadedness to occur, which can be a huge pain and discomfort for patients to feel. Also, there's an increase in varicose veins, and that's because this uterus and the growing fetus are putting pressure, and so the veins are trying so hard to get the blood back up where it's supposed to go, but there's kind of a blockade in the way. So the pressure is going to cause those varicose and spider veins to occur. Then edema. Now, mostly the edema is going to be in the ankles and the feet, but towards the end of pregnancy, it can happen in the hands, and this can cause carpal tunnel to happen. Now, carpal tunnel, if you remember or have learned, is going to be that achy and tingly feeling that the hands get, and it's just because of the increased swelling that's occurring there. So the carpal tunnel will go away post-pregnancy, not usually something they'll need surgery for, that we typically see for the pregnant patient. Once that fluid is absorbed and diuresed, then the carpal tunnel should fix itself. Leg cramps is going to be another concern that happens and makes women feel uncomfortable. So for our respiratory system, so as you can imagine, as that uterus is growing, that baby's growing, we're pushing up on the lungs. So there's just a decreased amount of space to breathe. So we have some shortness of breath occurring because of this. Also, we have the nasal congestion and stuffiness, and that's from the increase in estrogen causing that vascularity and the nasal stuffiness to occur, and a constriction that happens there. Then for our GI system, so the GI system, remember, everything slows down because of progesterone, slowing everything down. So women are going to have discomforts because of constipation occurring. So we have constipation. Then also hemorrhoids is another big problem in the GI, and that's because the weight of the uterus, the slowing down of everything, women might be straining a little bit more, and it's going to cause constipation. Also, all the veins are dilated a little bit more, so it's going to make women more prone to hemorrhoids, even if they didn't have them beforehand. And then nausea and vomiting, always a discomfort that can occur. And that is all because of the GI system, everything being slowed down. Heartburn is another one because of everything being slowed down again. And also because of the growing uterus, that fetus pushing up on the stomach. So when that stomach's being pushed up on, it's going to cause some reflux and could cause some heartburn to occur. So for our education, a lot of it is going to be symptom management because we're trying to fix whatever little symptom that they have. So we can suggest over-the-counter medications that they can take to ease things like the heartburn, the constipation. We can talk to them about diet. So making sure that they are eating high fiber, small frequent meals to keep that stomach from being empty. And then ginger is another little suggestion we can tell them they can get over-the-counter intake, and that will help with the nausea. That nauseated feeling, ginger has been found to help with that. And then if the patient's having trouble with lightheadedness, they should be taught things like rise slowly. So don't just get up and jump out of bed, but take your time, kind of dangle there for a second and then slowly get up, just to help with that. And then our last little piece is medications. So we want to tell the patients, different over-the-counter medications that are safe, and make sure they're aware that they're not all safe. Okay. We want to make sure that they're taking stuff that's safe for their baby and for them. And then we also want to make sure that any medications that they have already been taking prior to pregnancy, that they are also safe to continue on. And the last thing to think of for symptom management that I forgot to mention before is going to be compression stockings, or the hose. Sometimes could be helpful if they're having problems with the spider veins, that varicose vein problems, then compression hose or stockings can be suggested. So our priority nursing concepts for patients having discomforts with pregnancy are going to be comfort. We want to make them comfortable since they are having issues. So whatever we can do to make them comfortable. Reproduction, because the pregnancy is causing these discomforts to occur. And then hormones, because they're huge and they're causing a lot of these discomforts to occur. So just to review some key points here, the hormones that are going to be involved are progesterone, estrogen, aldosterone, and HCG. Those are our big hormones that are going to cause these discomforts. All systems are involved, so the entire body is affected. And then fetal growth. So just the pressure and the weight of that added growth that's happening and in the uterine segment as it's growing, the discomforts are being caused. It's causing a lot of pain during the pregnancy. Make sure you check out the resources and videos that have been attached to this lesson. Now go out and be your best selves today. And as always, happy nursing.